We are here at Colony Rehabilitation on the 3rd floor of Thomas Hospital, part of Infirmary Health. We have the director, Jane Bruton. Good to see you. We also have Hillary Sansoni, and Hillary, you have a special guest as well. Tell us who we have here.
This is Hoss. He is a Labrador Retriever, and he's a therapy dog.
Hoss is so cool. We're going to talk all about Hoss in just a second, but first, for the folks who don't know, what takes place here at Colony Rehabilitation?
Well, Colony is an inpatient rehab unit, which is very different from a nursing home unit. We have patients who have neurological problems and all kinds of difficult things to get over. They can't get around and they can't really do the things they need to go home. So they come here, they get 3 hours of therapy a day, and hopefully are discharged to the house.
One of the things we profiled before is just something as simple as getting in and out of a vehicle. We had that earlier. There's all different methods and means to trying to treat these patients. And one of the latest is with Hoss here. Tell us about how this all got started.
Well, we actually have a board member at Thomas who's very interested in pet therapy. But this is not a new deal. Pet therapy has been around for quite a while, and the appropriate animal really does wonders for patients.
Hillary, tell us a little bit about Hoss, and you've had Hoss since he was a baby, correct?
Yes, since he was itty bitty.
So tell us a little bit about what you've seen and when Hoss comes around, how it affects the patients and how it helps them as well.
Hoss loves coming to see all these patients. It just makes him happy, and seeing the smile on everyone's face really makes a huge impact.
Now, when you got Hoss, was the intent to have him as a therapy dog, or is this something that kind of just developed?
Yeah, I knew when I wanted a puppy, I wanted to do therapy because I love seeing, just making people happy.
So in what ways does Hoss make people happy? Is it pretty much just hanging out with the patient, or is there more to it than that, or is basically that all they need?
I think just petting him and seeing him happy makes them really happy. Sometimes he gets in the bed with them, if they're in a bed, and he'll snuggle with them. He'll just do whatever they want.
And like we said, there's all different methods and means to help people, and that's kind of what you offer here at Colony. I bet you're probably willing to explore anything that you think will help the patients long term.
Absolutely. Patients who come here, the average length of stay is 2 weeks. That's a long time after you've already been in the acute care for a while. And so one of the best things that Hoss does is provide a distraction from all the work that they have to do every day in the house. Plus, he's a great stress reduction mechanism, so people can focus on something else beside the hard work they're doing, and it's fantastic. We love it.
Hoss looks pretty stress-free right now.
Yes, absolutely. He conveys all that stress-free stuff straight to the patient. It's awesome.
All right. Well, what a great thing it is to have something like Hoss here to love and help these patients get through this difficult time. You can learn more about Colony Rehabilitation Center. We have all the information online on the Studio 10 tab on fox10tv.com. Jane, Hillary, Hoss, thank you all so much.